So we start first with the education to help her understand the function of how her patterns of behavior are working, to help get her on board and be more willing to engage in exposure work. And then before we jump to exposure work, I like to introduce some acceptance and commitment therapy skills in order to create a framework that we can use and we can use to strengthen us as we do and approach exposure work. So after doing education, I work with Sarah to help identify some of her values. Who and what are important to her in her life? What are the qualities or characteristics that she wants to embody as she goes out into the world? This is going to be her why. Why would she want to go through the pain and the fear of exposure work? Why would she want to put herself in experiences where she might experience a panic attack? Well, she wants to be able to do that so that she can do the things that are important and meaningful in her life. For Sarah, her independence is really important to her. It was a big step for her to move out of her parents' house. And she's really loved for the past couple of years living with her roommates, but also starting to build a life that's independent from that. Connection is really important to Sarah. Strengthening her relationships, being a supportive friend, being able to go out and have new and exciting adventures. She mentioned to me that she's only 25 and she knows that one day she might get married and might decide to have children and her life might become a little bit more stable and routine. And that she doesn't want to waste these years in her 20s not being able to go out and have adventures and have fun experiences, both with her friends, but also with herself. She explained that being able to go out and do activities by herself, being able to go out and explore the world, in her mind was a necessary step for her to be able to grow and become the person that she wanted to be. So we really emphasized independence, growth, connection, and adventure. And those were the 4 values that we really focused on and used as our kind of North Star compass as we were starting to approach exposures. Now, after values, I like to introduce some diffusion work that allows us to essentially get some space between some of those sensations, so those panic symptoms, as well as some of the thoughts that would come up, some of the worries about whether she might have a panic attack, whether she could escape or be able to get to safety or get help. We can do this through a number of different ways. So the first step is always helping a client see their experience. I like to describe it almost like we're little fish swimming around in the ocean. And there's a bunch of fishermen up above and a bunch of like hooks in the water. We all have hooks. Her hooks might look different than my hooks, but we all have them. And our goal is not to eliminate the hooks, but it's to learn not to bite them. And we can't learn not to bite something that we don't see. So helping her pay attention to what are some of the things her mind says if she even thinks about going for a drive on the highway or going on a trip with friends. Also looking at what happens when some of the initial sensations of a panic attack start showing up. What are the things that are happening in her body as well as the things that are happening in her mind? And the more she can begin to describe these experiences and see them, the more she's able to notice this pattern of avoidance that comes up. That this initial sensation, feeling in her body, or thought shows up. And then when she bites that hook, it yanks her off into another place that's far away from her values. So it takes her away from how she wants to show up in that moment, like saying yes to going on a weekend road trip with friends. And instead, she reacts in fear to escape and avoid a potential panic attack by staying home. And in fact, encouraging her friends to stay home so she's not by herself, or spending that weekend with her family because she can't be alone. While in the first part of therapy, we are describing to her what she's experiencing so that she can understand, eventually, my goal for her is for Sarah to be able to do essentially a functional analysis on her own, for her to look at her own behavior and understand, okay, what is that initial hook that shows up? What happens in response to it? Do I remove myself from a situation? Do I ruminate on it? Overthinking, overanalyzing, overplanning, kind of like a mental avoidance behavior? Do I say no to plans? Do I remove myself from the situation? And then helping her identify how that feels in the short term. So again, negative reinforcement of avoidance. She gets something from avoiding initially. In the short term, she gets a little relief. So she doesn't have to come in contact with a potential panic attack or something that feels very scary or even life-threatening to her. And then being able to evaluate, well, what happens in the long term, though? It keeps me cut off from my friends. I can't go into work meetings in the way that I need to. It's impacting my growth and my ability to be independent and live my life the way that I want to. So while initially we want to help explain things to her, help her understand, my main goal is to give her the tools and skills so that she can be better at evaluating her own behavior and understanding what works and what doesn't work. From there, I want to help her get better at being curious around the sensations that she's experiencing. This is a precursor to the work that we're going to be doing with the interoceptive exposure, helping her to be curious about what it feels like when she has that egg in her throat, or her whole body goes hot, or it feels like there's a weight sitting on her chest. You might have some opportunities in therapy. Sometimes, for example, when Sarah was describing even the idea of doing exposures or describing going on the trip, she would start to feel a little bit of an echo of those panic sensations. So not at the level that it was causing her intense distress, but enough that we could work with it in the moment. It's always easier to work with a sensation or experience while it's happening in the therapy room than try to kind of describe or give her tips on what to do when she leaves the therapy room. It's not as like raw and in the moment.